Good afternoon.
Good afternoon.
How is everyone today?
Good.
Yes, yes,
That's good to hear. Are we all coming back from lunch?
yes.
All
Can
right.
you
So,
see me?
I'm sorry.
This is a more question. Can you see me?
Oh yeah, we can. It does sound a little bit like the microphone is covered up a little bit but we can hear you.
Okay. But I don't know what I'm doing. As long as I can hear you guys, that's for me. For me.
I'm sorry. I didn't really catch that. Can you repeat that again, please?
I don't know what I'm doing on this computer. I'm trying to get the picture and everything.
Oh, you're trying to turn the camera on?
Yeah. It says music turning on it. Okay. Everything is
If
wow.
you're
But
if you're unable to get that camera on, there no worries. We can go as long as you're able to see our screen. Are you able to see the screen with the agenda shared?
Right, because it's back to school.
no.
So I suggested a 50-50.
And I don't
Right?
have
Like you
anybody here.
wouldn't want that to say yeah for back to school young. No, like what them kids.
Would you like for me to go ahead and share the
So
agenda
people
with
become
you?
like,
Sure.
Yeah? Let me go ahead and send that right on over to you, okay?
November. In November we
Thank
have
you.
the Black Friday. But it's
And
gonna
then
be in
for all of
4 days.
our
It's gonna be
partners who are
four.
on the
We didn't
call,
get the Black
are
Friday
we all able
shopping.
to see the agenda?
I would say. You know what I mean?
Want to
Right.
mute everyone if we can? There you go.
Thank you. For all of our partners jumping on the call, we do have the agenda up. There is an icebreaker on the agenda. The icebreaker today is in one sentence. What made you interested in learning about the Smart Referral Network today? You're more than welcome to unmute yourself and give us a response. The chat is also available. Feel free to write in your response within the chat.
Mhm.
This is Linda Patino. Can you hear me okay?
Yes, Linda, we can hear you.
Okay, I can start if you want. I would have to say is to strengthen collaboration, connect individuals to resources they need, and to better understand the resources available by using this network.
Nice, Linda. Thank you so much. Would anybody else like to unmute and share?
This is Lily with CSET, and we just signed our MOU a week or so ago. But we've always had an internal referral tool here at CSET. It was built internally in 2016. So for the last 10 years, we've been able to refer from one department program to another department. So it's only internal, nothing going externally. So it was interesting to hear about this opportunity, and leadership brought it to our attention. I'm one of the analysts here at CSET. My other analyst, John, is also listening in today. So exciting to see that this is coming to fruition in Tulare County, for partnerships and collaboration amongst different community action agencies and whatnot. So I'm excited because I'm a data person. So we'll see where this goes.
Great having you on board, Lily and CSET. Maria, I think you're muted. Sorry.
Thank you for that feedback. I'm sorry. And for all of our new everyone else jumping in, if you just recently got jumped onto the call, again, we do have an icebreaker on the agenda for you. In one sentence, what made you interested in learning about our Smart Referral Network today? You're more than welcome to unmute, or you can write that in the chat. All right, to continue to assist our members with all the resources available.
Learning about all the resources, connecting families to the great resources they're providing Kings County. A lot of great feedback in the chat. Thank you all. Strengthening partnerships. That's a big one. It's the technology can only get us so far. I think our relationships between different organizations are really what are going to close the loops and serve our clients better.
I agree. And our partners who are currently utilizing the SRN, the partnerships, from my point of view, I've seen our partnerships increase. There's a lot of communication with case managers going back and forth. A lot of organizations are currently working together. So this is beneficial to our clients who are benefiting from the services that we're providing.
Okay. Maria, I think you feel like we can move forward on the agenda?
Yeah, let's go ahead and move forward, Fedison.
All right.
So we do have county updates. Would you like to go first for Tulare County?
Yeah, so as Lily from CSET mentioned, CSET has signed an MOU, so we're happy to have CSET coming on board pretty soon. We also want to report that the Tulare High School District, I just finished a training with them, and they have active users within the SRN. They're mainly going to be referring out through their community schools program. So it was great to bring the SRN to the high school district and support their families within those school sites. And that's my update.
So for Kings County, we have officially onboarded one of our health providers. Omni Family Health has been onboarded to the Kings County SRN. So if you guys are interested in making any health referrals, you're more than welcome to submit referrals on behalf of our SRN program. Our Omni Family Health Clinic will be able to respond directly to referrals as well. We also would like to share with all of our partners on the call that our Kings County SRN page on our Kings United Way webpage has been updated as well. So we've made a couple of modifications to the website. So all of our partners who are using SRN in Kings County, there is a list of logos within that website. So you guys can go in and learn more about what Kings County has been able to progress throughout the time that we've had SRN here in Kings. And that's my update. So let's go ahead and move forward. Fedison, do you think we're good to move forward?
Yeah.
All right. So Lori, are you on the call with us?
Hi, yes, I am. Hi, Maria.
Hi, good afternoon, Lori. So we are going to go ahead and pass the spotlight to Lori. I'll go ahead and give her the opportunity to introduce herself and introduce the program she will be providing us some spotlight of services to. Go ahead, Miss Lori.
Okay, hi everybody. Good afternoon. My name is Lori Olivero, and I am the Community Outreach Manager with Anthem Blue Cross in the Medi-Cal division. And part of what I do for Anthem, and one of our biggest tenants is our community outreach and education. So some of you may have interacted with myself or with other reps in the past. If anyone is curious, if anyone worked with my Chi, the latest would be my Chi Vang. She just made a lateral shift to our LTSS services. And Will Sanchez, who I just saw the other day, and he's doing really well, and I love him to death. He is working in Cal-Aim with our competitor now. So he's not doing outreach and like I am doing, but he's working in Cal-Aim and he loves it. It was a great opportunity for him. That's where he wanted to evolve to, and we're happy for him. So I've been with Anthem for 9 years. I just passed my 9 years in February. So I have been around covering different counties at different times. Maybe perhaps we have crossed paths, perhaps not. But what we do is half of our time is spent at a community event, resource fairs, health fairs, baby showers, Father's Day events, backpack events, and Christmas, etc., turkey giveaways. And we at times dually support them, some with financial, and then with a combination that we build a partnership with the organization and construct a partnership, especially if it's a sponsorship, in a way that we gain access to the communities so we can educate both the educators, as I say, which is what I'm doing today, and educate the community on how to utilize their Medi-Cal benefits. And in my presentations, I'd go over some general information about Medi-Cal, very general, and then it is the focus on the value-added benefits for Anthem. Has anyone ever been part of a presentation, worked with Will, heard a presentation either for stakeholders? Okay, I see Victor up there nodding. I see Lamar, or somebody did a thumbs up. Maybe it was Maria, maybe it was Lamar Christian Aid. I have no idea, but I just saw it. I saw it come up. So that's great. And I trained Will. Oh, hi, Virginia. I do know your name from CDCR. But I trained Will. So we have very much the same style, except for he can speak Spanish and I cannot. But what I'm doing is I wanted to introduce myself and give you just a little preview of what a presentation is like, because I'm seeking opportunities to come into your staff meetings, your MA training, anything that anyone who works with the Medi-Cal demographic or social services community involvement, I'm happy to talk to them. And then I'm also very happy to speak directly to your groups. If you have support groups, parenting groups, we've worked with WIC in Kings County, anything where that demographic is, brought together for education, resources, services, etc. So I'm actually on both of my computers right now for a good reason. My speakers and mic are out on my laptop. So the big screens, I'm on my iPad looking at you right now. So if I go this way, it's only because I'm trying to share my screen from my computer. And you would think I would have this down. I said share. Okay, so there we go. So now I'm going to disappear. And can you see? Oh, I know you can see it because I can see it. The Medi-Cal 101 presentation. This is a somewhat slimmed down version. This one here is our approved one, and it has so many things in it, and I'm happy to go over them. How to renew benefits, changing health plans, medical care, examples, etc. But Will actually designed, he's like, if you know Will, he's like, nobody has time for all that. So he gave me a shortened version. So there's my information. We do call it a Medi-Cal Managed Care 101. And what we do is we start out by talking about how what Medi-Cal is. A lot of people, of course, that I'm speaking to have a strong foundation of knowledge about Medi-Cal. And so we don't spend much time on how long we've been in business. We've been in California since 1994, the counties that we're in. I get right into talking about, I shouldn't say that because I don't get right into talking about changing plans. That's one thing we don't do. We can't, we're not allowed to tell people, oh, you should change, but we are just educating them so they are empowered and learn how to advocate for themselves and make an educated decision. But if you're unaware, all Medi-Cal health plans in the state of California are created equally. We are managed care for the state, so we follow their rules. I always tell people they own the store, we manage the store. So we are guided by them, but we are allowed, so we have to cover any MCP, Medi-Cal care plan has to follow and cover the 12, that's now 12. It was 10 when I started 10 years ago, but 12 essential benefits. So they're doctor's visits, pre and postnatal baby care, of course, behavioral health, laboratory services, physical therapy, prescriptions, and of course, dental's rolled in it there, but we don't manage dental. Smile does a great job on their own. So we manage the providers, the members, et cetera. And any plan in the state of California follows the same regulations. So then why would there be more than one plan offered in a county? And it's a really good question. But it's up to the counties what they do. In Los Angeles, we're part of a 5-plan market. In Sacramento, we're part of a 4-plan market. It used to be 7. It's just what the county decides. They send out an RFP and we bid for the business, and here we are. So they do, with those options, they are allowed to change their plan. They're allowed to change their plan once a month. But they're always covered on a plan as long as they're eligible. So I like to get that out of the way because I do get a lot of questions. Well, which one's better? And I'm not allowed to, give that opinion by any stretch. But there are things that are unique to most MCPs. They find their way to stand out or to enhance services for their members and to improve their healthcare journey. So I move on to talk about, how you can change your healthcare plan. If anyone's ever worked with Healthcare Options, HCO, you know that they are a great bunch of people. But for those of you who maybe don't know, Healthcare Options is a great entity where people can go and receive just education, get questions answered about their social services. Medi-Cal, SNAP, CalFresh, they can go in there, and it's for the person that when you qualify for Medi-Cal, you get this big envelope packet, and it has a choice form in it, and it has 2 booklets, and that's really it. And the booklets are so thin. It doesn't give you a lot of information to really help you make that educated decision. So members and potential members can utilize Healthcare Options. They're a great entity. They are not a state entity. They are contracted by the state, and they're on their 2nd contract, so they're really great. I'm preaching to the choir for some of you, but some of you who maybe not know, they are awesome. When someone does qualify for Medi-Cal, they don't have to wait and send in their choice form. They can go right to Healthcare Options and select a plan and get information and then make a selection with Healthcare Options, or they can change their plan with Healthcare Options. So they're a really great middleman. Now, when we start to talk about, because I know time's ticking, when we start to talk about what's unique or why there's more than one plan, or why a member would change or a potential member would select one plan over the other, there are a lot of good basic reasons. Like they found a provider who takes one plan but not the other, and they really want to go with that provider. And I'm always a proponent of that. You find a doctor and you really like them. If they stop taking your Medi-Cal, if they stop taking Anthem and only Calviva, you should feel comfortable switching to Calviva. That's always what I tell them, because you need to go where you're going to be the most comfortable with providers. So that's a reason. That's generally the reason, unless somebody gets upset about something, and I try not to focus on that. But the what I do talk to people about is the value added benefits and how it benefits when I'm speaking to y'all. How it'll benefit having this resource, having this presentation will give you more resources to give your clients. And a lot of people, transportation is a big one. Transportation, people, when I schedule a presentation, people are like, how long do you need? And I say, well, I really need an hour, but I can do a half hour. And but transportation always takes the longest. So transportation is covered for Medi-Cal members to any of their doctors, dentists, pharmacy, behavioral health, all the essential benefits, all the doctors they're going to see, their specialists. In some cases, transportation is covered when you're receiving services from WIC. It just kind of and wellness programs. It just depends on the nature of it, and if it's been suggested or prescribed in some way by their PCP, their primary care physician, and or they're receiving food. And I'll get to that part in a moment. So when there is an app for transportation, so it's pretty easy for the savvy, but if people prefer to.
This case manager reads into every email as if it was directed directly to her.
Hello?
And
Somebody click their mute off. That's okay. It happens. So with transportation, they can take a companion with them. They don't have to be Medi-Cal. They do not have to ride alone. They can take their children as long as they provide, the proper safety seats and such. They can, and of course, they can ride with their children. They have to ride with their children to their appointments. Some families are mixed in their Medi-Cal health plans. So, mom will have Calviva, but the kids have Anthem or vice versa, and they're still allowed to ride, or actually required to ride with their children on that. There aren't any hard lines about that, but it is to and from. 75 miles each way is is the basic policy, but anything over that just needs the signature of the doctor they're going to see. That's no problem. They can call them on the phone. They can, if they have the app, they get to see the person that's picking them up, just like you would use Lyft or Uber. Now, Medi-Cal transportation is required by all health plans. It's one of the essentials. But with Anthem, we have made it unique to our plan to add a few years back now trips to the same no cost transportation for food security. So that includes grocery stores, food distributions, farmers markets, and food pantries. Anywhere they are going to receive a supply of food. So no trips to the drive-through or anything like that, but they will take them to any of those places where they can receive at least a few days worth of food. And that's been, widely popular. Some of the people that are living on their own, or if they have an illness. And in this day and age of how expensive gas has become, we really try to encourage them to utilize the transportation. And we do liaison with Motive Care. Motive Care is the company that both my competitor and Anthem both contract with Motive Care. They just have different phone numbers. So when the members switch plans, they're not unfamiliar with the transportation. So that makes it nice. Any questions about transportation? Has anyone worked with anyone or utilized Medi-Cal transportation themselves? Because we do appreciate feedback about it if there is such. Like I said, on my director, Janet Payne, she meets with them once a month to give them feedback. Because sometimes when you call for dental or food, some people will receive like, oh, we don't do that because someone isn't trained, or maybe they work on the other plan more or what have you. So we just really, when I am speaking to community members, I do try to say, hey, you have to speak up. So there is a 5-day requirement for appointments, and they set things up in advance. That's basically because once an appointment is made for a trip, they have to send something to the doctor, the receiving doctor, to make sure that the appointment is established. And then they also have to check with Medi-Cal to make sure they're still eligible of that day, they're current. And but there are exceptions to the 5-day rule. And that's also another place where when I speak to the community to encourage them to advocate for themselves, because if they are seeing a doctor on a Tuesday, if they're seeing their OB and he says, I need you to see a perinatologist, which is a specialist, on Thursday, if a member calls and says, oh, I need to set up a trip to the doctor, they say, oh, 5 days, and if they don't say, well, but it's for a perinatologist, it's for a specialist, my doctor is requiring this of me, the day I get the appointment, yada, 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 they won't, unfortunately, Motive Care is a third party vendor, so we don't have a lot of control over that. But we do encourage them to speak up, because pregnancy care, cancer treatment, dialysis, any chronic illness treatment is all the exception to that rule. And so is the grocery store. It's kind of hard to explain why wouldn't it be for other things, but it's because of the time it takes to validate the appointment and such. But they can get a 24-hour turnaround for food, which I think is wonderful. And they do cover some services for housing security, but it's a little more complicated than I've described with the food, because they schedule the food trips, the food security trips, just as they would a doctor appointment. But with housing security, they are usually working with our care management department first, and or a CHW, and they manage that a little more for them than my side of things. Any other questions? Because because of time, this is how to schedule. I can provide this information to you if you don't already have it, but you see here the advance notice. I forgot. No, I said cancer treatment, radiation, wound care discharges. The only thing about transportation before I sign off, because it is the biggest topic that I have, is if it's not already set up for a member, if a member has not already created a profile or an account with Motive Care, they're not able to utilize the transportation. So we give out brochures at the table, and they, I interact with them, and they'll say, well, I have transportation, I'm good, but thank you. They're usually nice about it. And I say, well, it's actually just a feature of the insurance that you have that you may want to research and establish early on, so you have it when in need. And then I give them the example of, if you end up in the hospital, you sprain your ankle or something like that, and you need a ride home because no one else is available, no sitter for the kids, etc. Hospitals know how to work with Medi-Cal transportation, but they can't not perform magic. You have to be an established member with Motive Care before you can use that transportation, because they will not take you to the emergency room, but they will provide transportation home when needed, but they really have to. So I always encourage people, if you're working with your clients, and especially CHWs, as just kind of an opening package, let's say, let's get your Medi-Cal transportation profile set up, and that way it's there when they need it. Okay, I think that's the last of it for transportation. I'm going to skip because of time. I have 3 minutes, so I'm going to go down to, how many of you have spent some time in urgent care? A real urgent care. You sit there. I have, but it's not always fun, and sometimes it feels like a waste of time, because you're in there for a cut, and you're not, or a rash, or pink eye, and you're just not as emergent or urgent as you think you are, right? I'm there, I wanted to see somebody, I couldn't get in with my primary care today, it's the middle of the night, what have you. So in order to supply that resource to our members, this is unique to Anthem, that we provided years ago. I've been here 9 years. I think it came on right maybe at my 2-year mark, but Life Health Online. Anybody familiar with Life Health Online specifically? It's telehealth, and it is a national company. Anyone can use it. You can see right there, no cost for Anthem Medi-Cal members, cost 59 those for those without insurance though. So it is something, if you're working with families, possibly one is uninsured, $59 still sounds like a lot of money, and it is, but it's better than a bill. It's better than an urgent care bill or an emergency room bill for a pink eye or a rash or something like that. If they are able to access it and pay the cost, it is well worth it, because they are board certified doctors, therapists. I don't know that I have to back up. I'm not 100% sure that those without insurance can seek the therapy, but I'll find that out because I've never thought about it that way. But so they are board certified doctors. And it is 24/7 access, on demand, smartphone or computer. And there actually is a phone number to call, but it just doesn't work. It's not the same, principle, but it is available. If internet were to go out in the middle of a session, they can call, or they will be called. But because, good old internet, especially in the rural areas. But as you can see here, you get to see the doctor's name, what their specialty is, what their credentials are, where they went to school, what languages they speak, before making a selection. That will even tell you how long you will have to wait for that doctor to come online. And most of the time there isn't a wait if you're willing to pick a doctor and go with it. Some people it's definitely not supposed to replace your primary care physician whatsoever, but some people tend to get their favorites on here. I've heard that from more commercial users, because I've utilized this for pink eye. It might be too much information, but a UTI, and I've also used the behavioral health services. Yeah, for urgent care, the physical side, it is solely urgent care based. I cannot stress that enough. Their first direction should be towards their primary care physician. They should call them. Can I get in? Okay. What should for any advice? But when they do need urgent care, this is available to them. And so it's just for urgent care. I don't know how many times I've said that, but for behavioral health, though, they can utilize it as an ongoing provider. Does that make sense? Because behavioral health is so hard, we all know, even commercial, non-insured, anyone trying to find a good a psychiatrist or psychologist, there's usually a wait. With this, because of the way that it's established, they can work with their schedules. They can they put in their information for the psychiatrist and psychologist side of things, the behavioral health side, and they have to receive a call back or a response within 4 days. Now, my experience was it was almost immediate, and you can switch doctors if you find one that it's not a good fit. There's not a lot of strong parameters on this for behavioral health. They want you to be comfortable. And of course, this flourished during COVID. There was high utilization, but there's actually more utilization now for the behavioral than there is the physical. Even though I think the physical is really handy, especially for babies, new moms, people who, have children they need to get off to school or to work. I think it would be a really handy tool when you don't know what that is in their eye. I always use the pink eye one because it's just a safe example, or little bumps on their hand to decide whether they're going to go to school. So this is something that they don't need to set up so far in advance, like transportation. They can download the app, put in their let me see if it gives you another page of information. Yes, they can put in their Anthem, their insurance number, ID number, and they put in their pharmacy and their email address, and prescriptions can be sent right to their pharmacy. There's only a certain level of medication that is able to be prescribed via Live Health Online, but these are some of the commonly treated examples. I have mine that I fall back on all the time, but headache, high blood pressure, they can at least get some peace of mind or education. But if a doctor feels that they cannot handle it, they will advise them to go to the ER. So common behavioral health, stress, anxiety, grief, panic attacks, coping with an illness, etc. And I think it gives you one more. This gives you kind of an idea of psychiatry versus psychology. This is not 24/7 access, but it is 8 to 8 and 7 to 11 for psychology. That's a pretty good, people who are trying to adjust to their schedules. It answers about children on here somewhere, 18 years and older for psychiatry and 10 years and older for psychology, which I think is also a pretty good limit for the availability of behavioral health services. So do I have one more minute? Just to make you aware, if you're not, members are entitled to interpreter services. So I do talk about that. We do have information on how providers can work with interpreter services, because that's generally set up by the physician, by the provider, and they are entitled to it in person if it is available. Someone can come and interpret for them, but generally, especially with some of the not so dominant languages, it will be by phone. They've tried to put it online a couple times, but there's always some regulation or something that's gotten in the way of that. But we have tried, because you would think, well, Life Health Online is there, why wouldn't interpreter services be there? But we have tried, we've just had roadblocks. I usually get that question. So this is if you need any, I always tell people, if you need any more information, I speak quickly. If we're having 2-minute conversation at a table, if you heard something in a presentation you just didn't want to expand upon at the time, it comes to you later. This is their customer care outside of LA County. And this is inside LA County, because LA County is, it's complicated out there for us, for any Medi-Cal plan. But what I love about California is we're always different, right? We're called Medi-Cal, not Medicaid, even though every other state in the union is Medicaid. We Anthem established our care team. The CARE stands for California Engagement and California Retention and Engagement Team. And it's a wonderful group of people in Los Angeles who they only answer calls for the California market. And that allows them the access to spend as long as they need to spend on the phone with a member or potential member to get their questions answered, or to get a new card, or, hey, somebody told me about this Life Health Online, could you explain that to me? Or I'm looking for a referral to case management, because we do have all of those departments within our managed care plan to assist our members. And we don't want our stakeholders, our community members, community leaders, CHWs, providers, thinking they are just alone with our members. We do want to provide other resources that to our members, and thereby to our people who work with the members, because unfortunately, I can't be everywhere every day educating our community. So you guys do a great job of assisting them. And that's why I asked for time to present this information to y'all, to your staff, to your clients, patients, etc. Just to, knowing about transportation, knowing about Life Health Online, knowing about case management is out there to, hopefully improve their healthcare journey, to improve their health status through education and accessibility to that healthcare. And I just appreciate Kings giving me the time. Maria, I know I don't make it easy, but I made it, and I really appreciate it. My information is available if you would like me. I am one person now. We went from 4 people. I can share my contact information in the chat. Is that what you would like? I'm happy to do that. I just got to find the chat in a moment, but I'm sitting here telling you, oh, have us in and everything. I am one person when we used to be 4 or 5. So I do a lot of things virtually now, but I also will work with you on different things, really try to make it happen. And that's it. You wanted, I'm going to go up here. I couldn't find the chat on my iPad, but here we go. Are there any questions while I'm doing that so I can sign off and let you get back to your important stuff?
Lori, well, just out of curiosity, is there any way you will be able to share that presentation with us?
I can't, it's the only thing I can say about it. I mean, yes, I can share the full one. The full one's pretty big and it has a lot of information. The first one that the first one, I have to send it to people who aren't going to share it with the community because due to state regulations, it's not considered a member facing document. I don't know if any of you are familiar with that term, but the state regulates what we can and cannot display to members or potential members, mostly for the, it's not proprietary information. It's just all things that are member facing have to be at a certain grade level. I hate to say it that way. The state requires it at a 3rd grade level. And this is not. So we are not allowed to share this. I couldn't send it to you so you could share it with your clients is basically what I'm saying. But if you want to read through it and get the information and you want to share it with them, great. If you want to have me come and share it with them, I don't show them. I brisk through this presentation, but we're not allowed to deliver anything to our members like this if it's not approved by the state. And it takes 6 to 8 months to, this took a year to get approved. So they're really tight on that. If I may just stress that to you guys, but I'm happy to share it.
Okay, just as
There's my
long as,
info.
okay, no, thank you so much, Lori.
Mhm.
Anyone who has any additional questions for Lori, feel free to redirect those over to the chat. Lori, thank you so much for your presentation today. It was very informational, and I know you do have a
Oh,
couple
good.
of questions in the chat if you would like to just respond directly
Sure.
through
Absolutely.
briefly review the chat and then just respond to those.
Sure, I will. And I'll go ahead and go on mute so you guys can, and turn my camera off so you guys can get down to your business. Thank you so much, Maria.
Thank you, Lori.
The way you worked with me. Thank you.
Thank you.
Bye, everybody.
Okay.
All right, just to redirect anyone, if you have any additional questions, please write that in the chat. Lori will go ahead and respond to those directly in the chat. We are going to go ahead and move forward with our SRN demo. Today's spotlight feature is going to be our economic mobility continuous report. It is a report that helps our organizations here in Kings County understand the gaps that are you all able to see my screen?
Yes.
Yes, okay. So the reports are available to our community partners for us to be able to understand where our clients are within their stress points and what connections they might be needing on their end. So again, we can have a client come to us for job assistance, and during that intake for job assistance, we start to discover that there's a couple more additional gaps of services that client has. So I am going to go ahead and demonstrate how these reports work for our clients. We are going to use a test account here today, just to kind of help demonstrate. All right, so we have, again, these are our economic mobility continuous reports, which evaluates the client's movements towards self-sufficiency by placing them across 10 life categories from a scale from crisis to thriving. As you can see here, we do have quite a bit of categories and focus points for our clients. So we have our educations, we have our employment, we have our employment, education, training, and so forth. Again, a lot of these topics are very delicate when clients are working with us, but it also tends to come off when we're doing intakes with them as well. Each category does have, or each focus point does have the categories for each oh goodness, I feel like I'm getting tongue twisted here. Each focus point does have those categories, and we do have a list of we do have that list for you available within the SRN where you're able to identify what category your client will fall under. You can actually see that with employment, we have our thriving, safe, stable statuses that help you identify where your client is when they're coming into the program. These reports, again, they're available for you to help identify what additional referrals might be beneficial for your clients to be made on behalf of your clients. So we're going to go ahead and pull up an old report that we have for our client Lola. We're going to go ahead and utilize the one for March 18th. It is a 3-month report that we will be utilizing today. So you can see this report goes back 3 months. This is letting us know that 3 months ago when we started working with Lola, for employment, she was falling in that vulnerable status. We were able to collect a little bit of information between the income as well. So you can see she's falling into that crisis status. And then we also were able to identify her housing situation. She was actually able to let us know where she was falling in when she did come into the program, and she's falling under that stable status. These reports are available for you to, again, help identify those additional referrals you're able to make on behalf of your client, but it also helps you track what progress your client has made. So we're going to go ahead and pull a report that was created on 6/17. Again, this is a report that is 3 months later. We're focusing on employment, income, and housing, right? So let's say Lola, you could see here, she moved from that employment over, or in that employment category, she moved away from that vulnerable status down to the thriving status, letting us know that there's progress being made. So let me go ahead and pull up how those reports would look on your end so that you're able to get a good idea of tracking. So in order for us to be able to identify the progress the client has made, we have graphs available for you. It's easy for you to go ahead and manage. I am going to pull the report first for 3/18, the report that was created 3 months back when working with Lola. You can see, again, we're color coding all of our categories. You can see she's falling within that vulnerable status for that employment. She's in that stable status for that housing. And then she's also for that income falling into that crisis status. With the report that was created 3 months later, we were able to see that there is a lot more progress that Lola has been able to make. So you could see that she moved away from that vulnerable, crisis, and stable status, and she moved up over to that thriving status. We're also able to go down and get a full view of the summary report. These are all referrals that have been made on behalf of the client. So when going back 3 months, if you wanted to just backtrack and say, hey, this client here for employment is falling in that vulnerable status. She might need some connections to some job assistance programs, right? If we continue on going down, we can actually see if there was any prior referrals that were created in order for her to make that connection to job assistance. And we're able to go ahead and get that report back tracked by providing an additional report 3 months later, and kind of recording that progress that client has made. So you could see that for employment, she moved away from that vulnerable up to that thriving status, letting us know that this client has made some connections to the referrals that we've been able to make. So this is a report that's available for you through the SRN. It is a very valuable report that provides you just a lot of information. It provides you a lot of connections. It helps you identify a lot of those connections and gaps that the client might be in need of. So I wanted to go ahead and demonstrate that for you guys today. This is a very valuable tool you have available to you. So I'm going to go ahead and stop sharing and allow you guys to go ahead and ask any questions regarding the report. Do we currently have any questions regarding the report?
This is Lily with CSET. Is that report only for like you can only look up a single individual at a time, or are you able to look up groups of people at a time?
You can actually look up groups of individual reports. So you can actually utilize the report summary. We do ask that you submit a time frame of what time frame you're wanting the reports to reflect. So let's go ahead and just focus on the start and end date for for today or for this month. And then you're actually able to go ahead and get a full visual of all of the clients you've created reports to, and you can actually filter that out as well. So you could see here, this is the complete report that was completed. You're able to see the full outcome of all of the reports you were able to capture on behalf of all the clients you're working with. And then you also have the client list available to you as well. So if you wanted to go ahead and filter out the clients that you have created reports to, like let's say that you're only working with a few selected clients because there's a good amount of individuals within that inbox, you can actually just select the clients you're directly working with. So let's say you're only working with Holly and with Lola, you can go ahead and edit that report and you'll get the full visual of the report and the tracking purposes. And then again, each one of these will download, you'll be able to download the full image. We do have the categories available to you as well, where you're able to identify these clients and the categories they're falling and the percentages they're falling under. We do have an Excel sheet that downloads as well. So it's an Excel sheet that has all of these responses as for your purposes to backtrack that data.
Okay, cool. Thanks.
No problem. Do we have any questions regarding the report?
Or does
And then-
anyone have any general questions about the SRN? Just overall questions.
If you would like to unmute yourself and just ask any general questions regarding SRN, we're available. We do have a few minutes available to respond to these questions. So feel free to open up the floor and ask any of these questions.
This is Lily again with CSET. Are we looking at the 1.0 or the 2.0 version right now?
That is the 1.0 version.
Okay. Okay. Follow-up question. Report-wise, is there a report that can be generated that shows the follow-ups? So, you know, when one agency is referring to another agency, you refer Joe Smith over to whoever. Is there a follow-up type of report that can be generated to demonstrate, like, if follow-ups were, if the referral was fulfilled?
Yes. So I believe status updates. So you should be able to pull, pick a time frame and pull your referrals down from that time frame. You'll get a Excel spreadsheet of all the referrals that are incoming and outgoing and the referral status. So that is a column on that spreadsheet that
Okay.
shows waiting, enrolled, declined, and Maria, I might be missing one.
Okay, cool.
Is that all of the statuses?
We have enrolled, decline, received, and closed.
Enrolled, yeah.
Oh,
Yeah.
enrolled and
Closed
closed,
isn't, yeah, that's another one. But the major ones are waiting, enrolled, and declined. Good question.
And then just to kind of help follow up a little bit, for documentation wise, when agencies are responding to referrals, there is a history section underneath the referral information that you'll be able to kind of track that information for your benefit as well. So if there is any documentation that was, any documentation that was provided from the receiving agency, you'll be able to actually pull up that information. You'll just open it up. It has the date frame right there. You just select the date frame that you're looking for, and then it'll open up that documentation the receiving agency provided.
Okay, if there are no more questions, Maria, I think we can wrap up this meeting.
All right. Again, our contact information will be left in the chat. A lot of you guys already have our contact information. If you do not have it, we'll go ahead and add that in for you as well. We do want to go ahead and let you know our next Alliance meeting will be held. Every Alliance meeting is actually held every third Thursday of the month. We will go ahead and host our next Alliance meeting on July 16th, and that invite, again, will be from 1:30 to 2:30 p.m. So feel free to jump on the call next month so that you can learn about SRN and all of our updates. And then just one last comment for all of our partners on the call. If you feel this meeting, SRN, the Kings-Tulare Alliance meeting, is beneficial to a community partner, feel free to share this invite. This invite is open to all partners in both Kings and Tulare. They're more than welcome to go ahead and participate, ask any questions, learn about the programs. And then I see we also have a hand up. Virginia.
Sorry, I hit it by mistake.
Oh, no.
I meant to
No.
give like a thumbs up and instead I put my hand up. Sorry.
You just volunteered for the presentation next month, so it's okay.
All right. All right. Well, Virginia, we might reach out to you for that presentation. So thank you guys all for joining us all today. Yes, Miss Lisette, you're more than welcome to share this Alliance meeting. Everyone have a great weekend.
Thank you,
Thank you,
ma'am.
Maria. Thank you, Fedison.
Thank you, Maria.
Thank
Thanks,
you.
everyone. Bye.
Thank you.
Bye-bye.
Bye-bye.
Mhm.